As colder temperatures approach, parents may worry that your child may catch the common cold or flu. But many parents don't know about another contagious and common virus that is contracted by nearly all infants by the age of 2. RSV is the leading cause of hospitalization for infants in the U.S. during their first year of life. Joining us now with more are actress and TV personality Vanessa Lachey, mother of 3 who has experienced the severity of RSV firsthand, and Dr. Michael Forbes of Akron's Children's Hospital. Dr. Forbes, what is RSV?
RSV stands for respiratory syncytial virus. We refer to it as RSV for short. And RSV tends to, it causes an epidemic every year, typically from November until March. Once it starts into the season, we see an uptick in the number of cases every year. We know that about 125,000 kids will be hospitalized every year and up to 200 will die. Most kids will get RSV and they'll have symptoms of a cold. But for some babies, especially those born preterm, meaning less than 36 weeks, it can become a much more serious infection.
And doctor, why is this something parents should look out for this time of year?
For this time of year, we know that once it starts to happen, the epidemic will run all the way till March, even sometimes till April, depending on geography and the season as well.
Vanessa, can you tell us about your son's experience with RSV?
Yes. Hi, Debbie. It was definitely one of the hardest experiences as a mommy I've ever had to go through, and I didn't know what RSV was, which is why I'm so proud to be sitting here today with Dr. Forbes, and I've partnered with AstraZeneca to spread the word and help educate parents and make them aware of what RSV is. I thought it was a condition. I didn't know that it was a seasonal, contagious, common virus that is actually almost 100% of kids 2 and under will get. And because our third, Phoenix, was born at 30 weeks premature, he's considered high risk. Because he's high risk, he wasn't able to handle this virus and fight it off like a full-term baby would. So I'm seeing all these cold and flu-like symptoms. I had him checked for the flu, and they said, it's not the flu, it's just a little virus, it'll pass. Well, it didn't pass. A week went by, it got so severe, he ended up getting ambulanced to the hospital. His oxygen saturation was in the 70s. We almost had to incubate him and almost lost him, and he was hooked up to a breathing machine for 6 days. So this is something that is extremely important and close to me to help let people know what it is, that it is as common as the cold or the flu, but nobody's talking about it. And in fact, it's the leading cause in infant deaths for babies 1 and under, more than the flu. So it was definitely one of the hardest experiences of mine and my husband Nick's life. But now Phoenix, a year later, is thriving and doing great. And I've kind of made it my mission to help spread the word.
Vanessa, what advice do you have for parents to help protect their children from RSV?
I think it's important to talk to your healthcare provider, your pediatrician, and find out if your baby is high risk. And what I mean by that is Phoenix was high risk, and I knew that he was high risk preemie, but I didn't also know what that entailed. Babies with heart and lung conditions are also considered high risk, especially for RSV. And then just in the daily life, especially during November and March, antibacterial soap on your hands, wash them, sing a song. We sing the ABCs, so they're learning as well. Try to use tissues as often as you can, because although you cough and sneeze in your elbow, which you think is being preventative, and while we appreciate that, germs can still live on your clothes.
Sure can.
Antibacterial wipes for their toys, and then trying to isolate the best you can any sick sibling. I know it's hard, I have 3, but it's not so terrible to kind of put them in the room and let them play for a few hours by themselves while the others are doing something else, because once it spreads, it's in a high-risk baby, it could be fatal.
Thank you. Dr. Forbes, why is it that premature babies are more at risk?
That's a great question. So premature babies are more at risk for 2 main reasons. The first is that their immune systems are immature. They've never been here before. They've never seen RSV. The second reason is their lungs are underdeveloped. And so those 2 things together really conspire to make that preterm baby more likely to have high risk or severe disease because they are high risk.
Doctor, are there any resources where we can get more information on RSV?
Sure. I think you'd first talk to your healthcare provider, your pediatrician, to find out whether or not your baby is high risk. As Vanessa mentioned, if your baby is preterm, if they have certain types of lung diseases or heart diseases, they're certainly going to be high risk. Talk to your doctor about that. And also you can go online to rsvprotection.com. That's rsvprotection, one word, .com. You'll get information about RSV and how to protect your baby throughout the entire season.
I'd like to thank you both for taking the time today to talk with us. Have a
Sure.
good day.
Thank you. Our
Thanks,
pleasure.
Debbie.
Bye.